Okay, everyone, good afternoon. My name is Joseph Galarraga. I am a faculty assistant in the Community Engagement, Environmental Justice and Health Lab at the University of Maryland. I work under Dr. Sacoby Wilson, who, as you all know, will not be able to join us today. And we are working with the Maryland Department of Health, the Environmental Health Bureau, on their EPHT project. EPHT stands for Environmental Public Health Tracking, and the CEEJH lab, Community Engagement, Environmental Justice and Health. We are specifically working alongside the Maryland Department of Health on outreach and technical assistance around the use availability of this data, the environmental health data that is being tracked through the project. And the EPHT program at the Maryland Department of Health, they're currently developing a new data portal. And a lot of the data that, I believe the most recent data on the data portal is from 2015, but this is currently being updated. But I'm going to go through and talk about how, more generally, how this sort of data can be applied to a number of different uses. Uses that can be used for, educational purposes, can be used for science, that can be used for action, kind of, not in that order, but we'll get to that. So I have a slideshow presentation that I'm going to use, and then also I think similar. I don't know how many of you were present for Dr. Cliff Mitchell's presentation. That was the second week of the symposium. I believe the 26th of September. He gave a presentation kind of with an overview of the project, sort of explaining it. I'm going to kind of touch on that as well, but also want to leave time at the end for feedback about the program and how the program can be more responsive to the needs of you as viewers, as the audience here, because you are stakeholders in the project. We really want to make sure that the EPHT program is working to help a variety of stakeholders, lots of different people. So you included. How would this data be useful to you? So I am going to share my screen, and we will get started shortly. All right, can everybody see this? Great. So, as I said, we're talking about using environmental public health tracking data in HIAS, health impact assessments, educational campaigns, and epidemiology studies, exposure studies. This is a program brought to you by Maryland EPHT and the CEEJH Lab and the Maryland Institute for the Applied Environmental Health. So here's the review that I was discussing. So what is environmental public health tracking? So this is straight from the EPHT site, the Maryland EPHT site. So EPHT is the collection, integration, analysis, interpretation, and dissemination of data from environmental hazard monitoring and from human health effects surveillance. Tracking aims to protect communities by providing useful environmental and health data to federal, state, and local agencies. These agencies can, in turn, use this information to plan, implement, and evaluate public health action to prevent and manage environmentally related diseases. EPHT allows public health agencies to monitor and disseminate information about environmental factors and disease trends, engage in research on potential linkages between environmental factors and health conditions, and implement and evaluate policies to prevent or control environmentally related diseases. So I think that one of the things to note that is, in this definition is that it aims to protect communities, right? That's I think, a key point. And it says it's providing useful information to, data to federal, state, and local agencies. Sure, but there's also the availability of this data by communities, by anybody, really. It's an open data source, data portal that is accessible. And that's sort of the point of EPHT, is to be responsive to community needs. So not only is this, useful to different agencies who can, take this information to make action, to inform policies, interventions, etc., but it also kind of democratizes the information so that, communities who are able to see the effects at the local level are really able to kind of maybe better communicate even with the policymakers, things like that. It's similar to, I know that some of you were in the My Block Counts program that I just gave. Having agency control of data really is important for communities, and has implications towards citizen science and being able to take environmental and health issues into your own hands. So before I go on too much more about that, we'll check out the next slide. So this is a graphic created by the CDC. EPHT is a program of the CDC, and different states participate in EPHT, Maryland being one of them. So we're talking about how tracking here, what is the utility of tracking across a number of different fields. So we're talking about, in that definition that we just saw, you could use it to target prevention activities. So that's like a public health perspective, right? Educate residents, has uses, in educational campaigns like we're going to discuss. Monitoring community health, once again, a public health sort of implication there. Informing city and state planning, so we can see it's multidisciplinary. Identifying communities at risk, that is relevant to the health impact assessment. Informing health policies, once again, relevant to health impact assessment, which we're going to learn how to use EPHT data in health impact assessment. And then supporting epidemiologic studies, which is sort of the last part of this presentation that we're going to talk about here. So really the utility of the data, a lot of data, is that and the power of data is that it has so many different uses, right? A data set is kind of like a tool that you can use in whatever sort of campaign that you're interested in conducting. So, all right, so the first thing that we're going to talk about is the health impact assessments, right? I kind of briefly touched on this, but to really dig into what we mean by this, it's health impact assessment is a process that helps evaluate the potential health effects of a plan, project, or policy before it is being built or implemented. So it's really in the words, but it's valuable. A health impact assessment is valuable because it's in a way it can be a preventive measure in itself. It really is tied into public health because you are looking at the health effects, the effects on well-being as well, before a policy is being implemented. So we're going to talk about a number of HIAs that have been conducted using EPHT data or in collaboration with EPHT in a little bit. But moving on, it brings potential positive and negative public health impacts and considerations to the decision-making process for plans, projects, and policies that fall outside of traditional public health use arenas, such as transportation and land use. So once again, talking about this kind of multidisciplinary aspect here of EPHT, we're looking at health data, but we're looking at it in relation to infrastructure projects. We're looking at it in relationship to industrial uses, things like that. So you're looking at how a new plan is going to impact the health of the community, surrounding community. And you see this graphic here, okay, there's a, a, a factory, very close to a stream, to agriculture, to, homes where people live. So how does that going to affect all of these various industries, people's daily lives, the watershed, things like that? So this is kind of a graphic that helps to explain how a health impact assessment works. If you were in the last session that I did, I talked a little bit about CBPR, or community-based participatory research. That is a huge part of health impact assessment as well. There is, in the steps of the HIA, which I will discuss shortly, community involvement is essential because similarly, who knows the conditions better of an area than the people who live there, who work there, who play there. That perspective really informs how, how a community functions. Bringing in those voices is instrumental in making sure that you're taking into consideration all of the health impacts, because there are things that exist in data that you might not be able to pull out otherwise unless you have the community's perspective, things like that. And there's things outside of data too that you're just not going to be able to see unless you really hear it from people's voices. So it's you have your health impact assessment, and you involving the community in decision making, collaborating with the community, and then creating this assessment through the help of experts. And then at the end of it, you have this evaluation. How is this really at the end going to affect the health of people, health impacts? So we're combining environmental and health data, and like I said, input from community and experts. HIAs can really be done by anybody, but it certainly is a collaborative process for sure. And we'll see some of the HIAs and the types of agencies or organizations, groups of people that have conducted them. And it informs policy decisions in planning, in creating power plants, in the institution of various laws, things like that. So health impact assessment is really also kind of a part of this like health in all policies perspective when it comes to policy making. How is health really going to be affected by any sort of plan, any sort of policy that is implemented? So here are the steps of the HIA that I was just talking about, and we'll talk about where community involvement is and things like that. So the first step is the screening. So this is basically deciding, there's a project that's being proposed. So let's say that, people are there's a company coming in to your town wanting to put a landfill next to, a big major road so it's accessible by all the dump trucks and things like that. So this is the stage where you're figuring out, all right, is it useful in making an HIA? Like, is this going to have an impact on what's going to happen? You're identifying the plan, the project, and the policy decisions that you're going to be kind of targeting with your HIA, right? So in this case, we're going to see the zoning policy that's going to maybe allow for this landfill to take up residence in your local town. And then the scoping is planning the HIA and identifying what health risks and benefits to consider. So and this is really where we see a lot of the community involvement here, is in the scoping process. You'll see that lots of times people who are conducting HIA really want to get a wide variety of perspectives on what the impacts are going to be and what people might want. A lot of times you see HIAs being used to talk about a various industry that's going to be moving into town or whatever it might be. And a lot of people see the economic benefits of various industries. People need jobs, people need to work, people need to make a living. And so that's something that's often considered is what are the benefits as well. So kind of seeing how communities feel about these things and then what their concerns are as well. So that is sort of involved in the scoping process. So, and then you get to the actual assessment. And you'll see I've kind of broken it up into the baseline health assessment and then the potential impacts on health. So your baseline health assessment is seeing where you're at. Like, what is the, you know, let's say we're talking about a landfill, maybe what's the, cardiovascular health maybe, because cardiovascular health is affected by air pollution. So if you already see a high incidences of disease, you want to note that. You want to say that we have populations here that are already vulnerable because they have poor cardiovascular health. You might want to look at cancers, clusters of cancer, things like that, and seeing, you know, what would bringing in more hazards potentially have an effect on that. What are the the health effects of the industry or potential infrastructure project or whatever it might be coming that's proposed. So that's sort of what you do in your baseline health assessment. And then, yes, you go to the potential impacts, right? So you think about what are the, what might be coming from the industry or infrastructure project or wherever it might be, and how that might change. And ways that people often do this will be kind of comparing the health profile to a place that maybe already has this sort of industry there or has completed this sort of infrastructure project, and showing how that change has maybe happened over time, right? Recommendations. So after, you do the health impact assessment, you can say practical actions to propose that promote health and minimize the negative health effects if, the jurisdiction goes through with the project. That's a big part of it. You want to have a plan in place so that, let's say that there's this thing, in the case of the landfill is going to come sort of no matter what. Hopefully your HIA can be used to maybe try to relocate it or something like that. But your recommendation, you want to be prepared for what can happen in the scenario where this goes through, and how can you actually protect people's health despite something happening that might have harmful impacts. So then you're reporting, you're trying to get, at the end of your HIA, you're trying to get the results of it out to people so that people know. You want to say, like, all right, we believe that the landfill coming in is going to reduce the quality of the air based on such and such data that we've pulled from areas that have this kind of landfill, things like that. And you want to communicate that. So there's the reporting part of the HIA where you are disseminating info. And then the last part is monitoring and evaluation. So this is basically seeing, like, was the HIA at all effective? Like, did people take into, did decision makers take into consideration the recommendations? Did the project get funded, or did the project, was it completed? And then also looking at monitoring health effects too. So let's say that the landfill gets completed and moves into town, and then making sure that you're maybe doing health assessment surveys periodically, things like that. So this is like the steps of your health impact assessment. And these are some of the health impact assessments that are on the EPHT site that have been completed using EPHT data or in collaboration with Maryland Department of Health, Mental Hygiene, things like that. So this one that we see, the top one listed, was done by the Wacomico County Health Department, in which tracking data were used to map asthma emergency department visits and mortality at the county and zip code level around the location of a proposed farm. So what we know about farming operations is that generally, as in the case of something like animal agriculture, there is a lot of particulate matter associated with farming. So I believe later in the evening or later in the afternoon, there's going to be a session about CAFOs where you can learn more about that, confined animal feeding operations, and the health associations with those. So if there's a lot of particulate matter in the air, it might trigger asthma, right? if we already see high levels of emergency department visits via the EPHT data and mortality, then we can show that it's only going to get worse through this farm operation occurring. So the next HIA that we see listed here is done through the University of Maryland, and actually Dr. Wilson, who was supposed to originally be discussing this EPHT data use with me, he helped complete this HIA in Western Maryland. So this was, as you can see here, the Maryland Institute for Applied Environmental Health, which is the department that houses the CEEJH lab, provided a baseline assessment of current regional population health, an assessment of potential health impacts, and possible adaptive and public health migration strategies in the event that natural gas extraction takes place within Maryland's Marcellus Shale resource. So that is in Garrett and Allegheny counties out in Western Maryland. We're going to talk a little bit more in depth about this HIA in just a moment, because it is an example of an HIA that has the baseline health assessment, things like that, and because we as a lab were heavily involved in this HIA. And then in 2013, this was an evaluation of a proposed rail intermodal facility that studied 6 determinants: air quality, employment, neighborhood resources, noise, traffic, safety, and light. So looking at how all of those determinants would change as a result of this rail facility being built. And we know air quality has detrimental, like if you have reduced air quality, it's going to be detrimental to populations, but weighing that against the employment options and weighing that, that's part of the impact here is you're kind of in an HIA trying to determine if if your proposed project is going to provide more benefit or more harm. So this is the 2014 Marcellus Shale HIA. This is Dr. Wilson here on the right during the scoping activities, meeting with community groups in the area to discuss what their concerns were with these natural gas extraction fracking activities in Western Maryland. So here was the purpose, was to, yes, like I said, natural gas and extraction in Marcellus Shale. And the scoping, how was that carried out? Through public meetings and comment periods. And what ultimately happened was that there were 10 themes emerged, things that people were concerned about. And similar to what we see in the intermodal facility, it was similar themes, air quality, water quality, general overall community health, employment options, what benefits are going to be brought, et cetera. So then what happened was Dr. Wilson and other partners from the Maryland Institute for Applied Environmental Health did a baseline health assessment. So these areas in Allegheny and Garrett counties already had high levels of PM 2.5, which is size particulate matter that very easily gets lodged inside of lungs. What was also found was that 58% of private water wells overlapped with the Marcellus Shale gas leases. So there was a lot in the way that the land was gridded out. It looked like more than half of the private wells in the area would be affected by this sort of drilling and extraction. In terms of populations that potentially could be affected, we saw vulnerable populations in the case of elderly people and low wealth populations, folks who might not have the means to be able to take care of their health, and as opposed to people who have lots of access to money and resources, things like that. And there are also higher incidences of cancers in this area compared to the state average. So we can already see that the baseline health of these areas there's a lot of risk here. So looking at the actual impact assessment, which was compared to a county in West Virginia that already had this sort of drilling facility extraction practices going on, there is a high risk for increased VOCs, volatile organic compounds, which are these compounds in the air that help form ozone. They really are very impactful on air quality. There was a high risk of groundwater contamination from these 58% of private water wells. There would be an increase of traffic, which also has impacts on noise, air quality, etc. There also was noted, and this is when we talk about HIAs being multidisciplinary, an increase in crime. And this is because through bringing this sort of industry into town, you're bringing more people into town, and perhaps people who are working in some of these facilities, there's a potential that these folks might be contributing to crime. And this is what was found in the case of West Virginia. And an increase in healthcare utilization. And that while that might not sound bad on the face value, like if you have healthcare, use it. Well, that also demonstrates that people are utilizing their healthcare because they have more problems, right? So that was sort of the by comparing the conditions in these counties to those further away in West Virginia, not really that far away, that had similar conditions, that we were able to see that this was maybe the impact. So came up with a number of recommendations, comprehensive gas development plans. I'm seeing that there's something in the chat. Jerry, I'm gonna answer your questions a little bit later on, but thank you for putting those in the chat. Comprehensive gas development plans that require emission permits from the Maryland Department of Energy for each well pad. Air monitoring to make sure the impact of these industries is not terribly detrimental to the air quality. Things like that. So this was how this HIA went. Okay, and so now we're going to talk about data sources for the HIAs and how we can use EPHT data in these sort of projects. So we have this mapping portal. And maybe if we have some time at the end, I'll open some of these things up so I can do more of a demonstration. Also, the mapping portal that's currently up, like I said, EPHT, MD EPHT is currently updating a lot of their data, and they are also updating the portal with the help of Towson University. So, but it might just be useful to take a look at its utility. But the mapping portal can simultaneously map Maryland health, environmental, and socioeconomic data at the county, zip code, and census tract level. So you're able to show, put health effects down next to environmental data. So you might be able to show PM 2.5 versus various gradients of household income, and then also map that against myocardial infarction. So you can see how outcomes play out based on these environmental and social factors. There's also these query tables where you are able to get environmental and health data stratified by year, race, ethnicity, gender, or county. So once again, you can see how different populations are affected across the state in terms of environmental data and health data. And then there are these county profiles, which we sort of see this is what the portal for these look like currently on the EPHT site. You're able to basically click each one of these counties and pull up a profile that shows at the county level, it focuses on social, demographic, and environmental factors that are thought to be important determinants of health. So you're able to look at what the various factors that influence health, maybe in Montgomery versus Prince George's, two neighboring counties right next to each other. So these are tools that would be extremely useful in being able to measure, how places that are right next to each other might differ with the addition of certain types of facilities or certain types of industries, etc. You can use this as almost like your comparative counties, one against another in that way. So we're going to move on now to talk about educational campaigns and the use of MD EPHT data in those in that setting. So, you know, according to the CDC's Health Communication Playbook, there's a few things that you need to keep in mind for health communications and educational campaigns. So this is more of a kind of like a background how-to. You're going to want to include key messages and talking points. And what does your target audience absolutely need to know? And I think that specifically with regards to educational campaigns, this is like one of the most important things to keep in mind, is that you're ultimately have an audience for your educational campaign that is not everybody, right? You're trying to reach a certain group of people, and that is really essential in how you design your campaign. And that's why it's like important to do key messages and talking points at the very beginning, because the rest of this kind of falls based on that, right? So you're going to want to make sure that you write clearly, make sure that your materials communicate the ideas well, and that is very important depending on who your audience is. So let's say you're trying to create an educational campaign for middle schoolers versus people AARP 50 plus aged people. You're going to have design your materials very differently. The language that you're going to use, the clarity, how instructional things are going to be is really going to be based on who your audience is. The CDC recommends in health communications that you try to tell a story. And I think that you see this a lot in many types of communication. People really grab onto stories because it helps grab attention and makes things relatable. When you are able to see how something related to health could affect you or a family member or something like that. And then the last thing is to use design and a layout effectively. So when you're creating an educational campaign, the materials that you're using, you want to make sure that you are utilizing visuals in a way that is a boon to your project as opposed to confusing it or anything like that. So this is, okay, I'm going to, I guess these slides got a little out of order, but I'm going to, at the end of this presentation, put these slides into the attendee packet so everyone can access them. And so this actually is the MD EPHT HIA toolkit. Yeah, so this is out of order. This was supposed to be at the end. So this would be able to help you more in using EPHT for HIAs. So my mistake in the misordering of these slides. But so we're talking about who's your audience, right? When it comes to an educational campaign. The communication playbook talks about things that might be more suitable for consumers, such as fact sheets, web pages, social media. When you're creating your communications for a general audience, you want to make them be accessible in ways that people generally access information. So people go online, people use social media. You know, a fact sheet is something that's easily digestible by somebody who's maybe not a public health professional or something like that. So when you're creating communications for your general consumer, these are things that you might want to utilize. When it comes to creating an educational campaign that you're going to be spreading through media, then you want to make sure that you have press releases, media advisories, and interviews. These are types of communications that are, spread through television news, through newspapers, things like that. You have an editor pick up a press release and is able to turn that into a story that, and what we talked about earlier is telling a story is important. And so if your educational campaign is going to go through a professional network, you're going to want to do this more in an academic setting with poster presentations and communication plans, etc. So these are sort of just some background guides for when you're coming up with an educational campaign. Who is your audience? Who are you trying to reach? Things like that. So this is an example of an EPHT educational campaign, and how this is done at the national level through the CDC, and the Maryland EPHT team participated this past year, 2020. This was in July, as you can see, July 6th. And this was one of their educational campaigns, and how they focused the communications around it was important, and it was done day by day. So Monday was focusing on the fact that EPHT has unique data, and that's some of the data that we talked about previously for HIAs. Tuesday was talking about expanding partnerships. Wednesday, impacting policy and improving processes, which, as we saw at the, at the beginning, that slide from the CDC is that, EPHT data is used to impact policy. It's not just here for monitoring. We're trying to make this actionable. Thursday was, once again, put the faces of tracking, making this relatable, creating a story. Once again, that's a great way in communications to make things, kind of jump out a little bit more. And then Friday, celebrating successes, which is always important. When you are working on a project, you want to make sure that you celebrate when you've completed something. So how can we use the EPHT tools and data? Once again, how can we apply this now to educational campaigns? Well, another thing that exists, and that's kind of like, this is a screenshot from the site here, are data maps and galleries. So this is existing maps and graphics on EPHT health topics and environment topics. So this is something that you can, pull from sites or pull from the site right away. That is, the type of communication that's like very easily readable, maps, graphics, once again. So these already exist. So like if you're talking about, blood lead levels or, occupational health, whatever it might be. And if you can't find something that already exists, you have the ability to create your own map, as we talked about before. So you can overlay health, environmental, and socio-economic indicators with other data. So this is, once again, maybe your educational campaign has something a little bit more specific that you want to talk about. You may be talking about PM 2.5 in relation to racial distribution. Well, you can create your own map that really demonstrates that. That'll be useful to your educational campaign. And then we have these health topic pages that are also on the MD EPHT site that link out to other resources. There's lots of different reports that are there that are generally written, once again, for more of a consumer audience. So you can, leverage that, utilize that, quote that in your educational campaigns. There's frequently asked questions. Once again, FAQs are a great way to communicate information. And then there's more graphics on health topics here as well through EPHT. Great. So now we're going to talk about the use of EPHT data in epi studies. So this is a definition from the NIH for, at this point, especially in the time of COVID-19, I feel like epidemiology is no longer as much of a niche field as it once was. But epidemiology studies are conducted using human populations to evaluate whether there is a correlation or causal relationship between exposure to a substance and adverse health effects. So this is like a definition from the NIH Tox Tutor. And I like this definition. I think it's pretty good. I think it's interesting when you say epidemiology studies are conducted using human populations. And I think that sometimes that might bring to mind sort of like what's the word I'm looking for? Like a biological study. But a lot of times this is data that's collected through survey options. There's one of the things that's listed on the Maryland EPHT site also as resources are surveys. Like there's the BRFSS, the BRFS, that's a health survey that goes down to the county level, I believe, where you can find people's responses to a survey about a number of different health questions, socio-demographics, things like that. There's also, I'm trying to think of some of the other ones of the other surveys, but we can talk about those later as well. But I think that it's important to recognize that, epidemiological studies are, oftentimes just using secondary data. You're not necessarily Depends on the type of study that you're doing, which we're going to talk about in just a second. Not necessarily going to be having, a dedicated sample of individuals. So here we are talking about the types of epi studies. There's a cohort study. So this is, a group of individuals with exposure to a chemical, and a cohort without exposure who are followed over time to compare disease occurrence. So this is really a case where you're going to be looking at a well-defined sample oftentimes, because you're going to be looking at people who specifically have an exposure and those who specifically do not have an exposure, right? A case control study, and this once again is very well-defined sample in the sense that you're going to be looking at individuals with a disease, and those are compared to individuals without the disease. So this is a case that you're looking at. A cross-sectional study is the prevalence of a disease or clinical parameter, among one or more exposed groups, such as the prevalence of respiratory conditions amongst furniture makers. And it's a cross section, and this is a good way to think about this, is you're just looking at like here, just it's a splice in time of what's happening amongst all these people that are furniture makers. You're not necessarily following anybody, and that's a difference between a cohort study and a case control study. You're seeing it from the beginning, and this is just a snapshot in time for looking at a condition amongst people who do this certain profession, or maybe like live in a certain geographic area, whatever it might be. So, and then an ecological study is one that generally takes place in a geographic area compared to another area. So this is when I was talking about, there's not a defined sample. That's probably not honestly the best way of putting it. It's just more that, in an ecological study, you're looking at people maybe in one zip code compared to another zip code. This is definitely the purview of EPHT, or would be this sort of ecological study, where you're able to look at one area versus another on a map, looking at various environmental factors, looking at various health outcomes. That is going to be really what we're going to be doing a lot of with EPHT data when it comes to an epi study. Not so much, the cohort with, like I said, following from beginning to end. So I think that looking at EPHT, you're able to see, or the history of the Maryland EPHT, this is like the milestones that are listed on the site. You can see that, okay, we have the tracking program was established in 2002. In 2008, we had the site. And then really we start to see some of the studies that were conducted by EPHT that really are epidemiological studies. And we see this one right here in Poolesville, looking at cancer clusters. We're talking about biomonitoring, the feasibility of that, and then once again, a cancer investigation. And we're going to look at this Poolesville example for as a study that can be used as a model for a kind of epi study that might be able to be conducted using MD EPHT data. So basically, there was a concern that Poolesville in Montgomery County was having higher incidences of cancer compared to the surrounding region. So what was done here was that we looked at cancers by various age groups and by gender, and looking at that as an expected, you can see this is like a chart that shows expected based on Montgomery County data. This is the incidence ratio, SIR, so the standardized incidence ratio. So how often we see the cancer compared to Montgomery County within Poolesville. And then we see the zip code compared to the confidence interval. So how sure are we that this number that we have here is correct? within 95%. If it exists within that, then we could say we're pretty confident. And ultimately, I think that, you know, without getting into the too much in depth on this outcome table here, we can see that this last column right here, zip code 20837, statistically different from Maryland. So this is looking at, is Poolesville statistically different compared to the state of Maryland, or statistically, and here we see statistically different than Montgomery County, right? So that's basically what we're looking at here. This is the expected or the incidence ratio compared to Montgomery County. This is the incident compared to the state of Maryland. And you'll see that when you have an incidence ratio like this, that's like 1.12. All right, so there are more cancers in Poolesville than what we're expecting based on Montgomery County data. 2.0 between 0 and 19, so twice as much, right? And then 73, okay, less in that age group, less in this age group. And there's more in all of these other age groups, and then when you split it by gender, there is more as well. But is the amount more that we're looking at actually significant? Like when you take into the fact that you know, that there's maybe not that many cases overall, right? You know, in this case, it's like, okay, it's twice as many, but it goes from 4 to 8. You know, that could just be does that doubling show any statistical significance? And so what we find is that actually there's only one case, and that is between 60 and 64-year-olds, where there is statistical significance in how we measure this, right? So, and then compared to the state of Maryland, there is not. And so this is an exposure epi study, you know, based on zip codes, based on comparing to, you know, the overall incidences in Maryland. And it was found that there is no statistical significance between the cases of Poolesville, except for in this one instance. So therefore, the report that we just saw, let's see if I go back. Oh, how do you go back? Here we go. The report concluded right here that there are no evidence of cancer clusters in Poolesville. That ultimately, while there was a lot of folks that were unfortunately experiencing cancer, it was not too different than what we can expect at the state level or compared to Montgomery County. So, and now what I'm going to show you here is, once again, like we did with the educational campaigns and with the HIAS, sources and data for epidemiology studies. So this is where you are able to pull like a query table that you can use the data for your study. And so we'll look here like what's available, right? The type of data, the indicators, rows and columns. So what I've looked at, I decided that, you know, the kind of study that I want to look at is I want to see the incidences of elevated blood lead levels by county and by year. So I looked at type of data, blood lead, percent elevated lead. So, 5 micrograms per deciliter here, looking at counties and the year. So looking at for the year 2014, all of the counties, all children, all zip codes, and all genders. And I printed only a table. So what we're going to be able to see here is a kind of like a snapshot. I wasn't able to fit all of the counties in the slide, but we'll see that. All right, I can see here, the rate of high elevated blood lead levels for 2014 across the board. And you can also see the counts too. So you can see, for instance, Baltimore City has, the most by far. You could also see quite a bit of elevated blood lead level in 2014 in Prince George's, right? And so here we are. We have, these rates of elevated blood lead levels based on the amount of tests performed and the 95% confidence interval that shows that, what the certainty of this value is. And then what can I do with this? Well, I may be able to demonstrate it similarly is, the incidence of elevated blood lead levels in a place like Calvert County very significant compared to a place like Garrett County. And I can do those comparisons, looking at, incidence ratios, odds ratios, things like that. And that is really the applicability of EPHT data to an exposure epi study. So right now, I think that I want to take some time for some questions, and then maybe in a little bit, we can talk about or go look at the EPHT site. Particularly, I think that the HIA toolkit would be something that would be useful for us all to look at. It's that link that I had earlier in the presentation, but I now have been talking for quite a bit of time, and I feel like maybe it's time to let some other people talk. So does anybody have any questions? And we can either use the chat or you can turn on your mic, and I will try my best to answer them. Oh, well, there were those questions that Jerry asked earlier on in the presentation. So our models used to both project possible impacts and to assess possible mitigations and recommendations. That this is referring to the HIA. A model it depends on, the type, who is conducting your HIA. If you have people that are adept in creating models, yes, like generally people are modeling this data. I personally am not really involved in modeling myself. It's not my expertise, but yeah, generally people on your HIA team who have expertise in modeling, you're not necessarily just making raw comparisons. You can use it based on a model as well to help predict health impacts as well. And okay, so, and this is in the case of also the Marcellus Shale. Not that I am in favor of fracking, but were any positive impacts identified, and did the local community see any positive impacts? So I think that it inevitably, there would be an economic benefit there, and I think that was a concern that was brought up in the scoping process. In terms of if that was found in the impact assessment, I can't recall specifically from the HIA, but you know what? I'm going to find it. I accidentally, I'm going to try to find that Marcellus Shale HIA, and I can link it in the chat. Here it is, and we can, I invite you to review it on your own. And I just unfortunately don't have that off the top of my head, Jerry. Oh, so that is the link. Maybe it's broken. We will find out. And yes, is raw data available? I believe that is the case. Linda, I see that you're on the call, and Linda's an epidemiologist. Would you happen to know the answer to if there's I know that you can make data requests. What's the availability there?
Sure. I don't have a 100% answer for you, but I'm leaning towards no, just because we have a lot of data use agreements in place with our data stewards for getting that data to display on the portal. So I would say you're welcome, if you want to see the raw data, to reach out to us and we can sort of see what we can do to help you. But generally, there's not really a way to download raw data straight from the different data stewards from the portal.
Thank you, Linda.
Sure.
Let's see, does that link work when we click it? Yes, it does. Okay. Does anybody else have any other questions or comments? like I said before, we also are curious about how we can make EPHT more responsive to your needs as stakeholders. So anything else? All right. In that case, I think that it'll be useful, like I said, to check out the HIA toolkit on the tracking site, because there is quite a bit of resources here that I mean, things that are related to HIAs and then can also have other applicability. And I think that one of the things that I really want to demonstrate, because we really talked about Maryland HIA data sources, but there's also, I understand that especially now that this webinar or have the symposium is a webinar, it's virtual, that there's probably plenty of people here that are curious about doing things beyond the state of Maryland. You know, I know that there's particularly probably a big contingent of Virginia people on this session, because there's the EJ in Virginia panel that's also happening. So I'm going to share the screen here. Here's the HIA toolkit. Right, so you'll remember this graphic from my presentation. But here we see the various HIA reports. So Jerry, we can see this is the Wacomico County. Here's the Marcellus Shale. Here's the rail. But let's look at the national HIA data sources for people looking beyond the state of Maryland. And these are probably data that many of you are probably already familiar with in some ways, but I think that there is the CDC tracking info by location. So I thought that this data source was really super interesting, because you can go by county name and really just enter any county into this site and find environmental issues. Here is the, Census Bureau ACS data, common data source for a lot of different epi studies, county health rankings and roadmaps. There's, I think this is done through the Robert Wood Johnson Foundation, county health rankings. So kind of uses a number of different metrics to come up for like the most healthy and least healthy counties in your state. So I know that if you immediately want to be able to cite a source of data that shows that, oh, our county's at risk, you could say, we rank 45 out of 47 counties in whatever state you might be in, based on the county health rankings by Robert Wood Johnson. And so here we have some screening tools, and I believe that there's a demonstration of the Maryland EJ screen tool that the CEEJH lab has been working to develop later in the program today. I think at the next concurrent session slot, we will be discussing the Maryland EJ screen tool, in addition to our park equity mapper that shows green space and the accessibility of green space by various communities. And so I think that using a lot of these tools in tandem with data, et cetera, is going to be able to create, it's going to be very useful to an HIA. You have the ability to show an EJ screen score for, I believe this goes down past the county level even. Let me see. You can really zoom in with this, and you could, it's aggregated at a certain level, but you can show an EJ screen tool for census tract, et cetera, demonstrating once again that your baseline health maybe is already not great, which is helpful in your health impact assessment. here's the agency. This is the social vulnerability index that is similar to an EJ screen tool in that it identifies communities that might need support in preparing for hazards or recovering from disaster. So I know that this tool is used a lot by FEMA and things like that. The index is comprised of negative effects based on social, economic, and demographic characteristics. So kind of pretty similar to how the EJ screen tool works, but instead in the context of disasters. So if you are, a consideration for an HIA when you're maybe proposing some sort of chemical plant or something like that is if you have a very high social vulnerability index there anyway, in the case of, a disaster, like and there's a lot of concern when you have, a natural disaster that you might be triggering an event where it's called a NATEC event or NATEC event, where all of a sudden you have these chemicals that are flowing, out of the plant during a hurricane or whatever it might be. And then you have a high social vulnerability. That's a concern that needs to be included in your HIA as well. And then, there's you could use the Department of Transportation tool to show transportation and public health indicators, how they relate, how public transit is certainly part of a determinant of health. Things like that. So yeah, I think that there's a lot of other tools that you can use at the national level if you're sort of expanding beyond doing HIA for the state of Maryland, for instance. Great. So I believe we have just about 15 minutes left. So I'm going to stop sharing. And I wanted to see if anybody else had any more questions, feedback, things that you would like to see, things that we could add to the presentation, etc. Okay. Well, in that case, we might just end this session a little bit early. I appreciate all of your attendance. I'm going to put the Maryland tracking site link in the chat so you all can see, the portal as it stands now. There will be an improved portal coming, like I said. Also, like I mentioned previously, we will be including the slideshow. I'm going to place that in the attendee packet, which Yan has linked in the main room for day 4. And then we will also share that packet again after around the closing session. So I'd like to thank all of you so much for being here. And I guess once again, it's last call. And if not, we'll end a little bit early. Maybe you could, have a little lunch before the 3rd session. So thank you, Linda. All right, everybody, take care. And I hope that you enjoyed the last concurrent sessions. And then we have the JEDI 2.0 discussion I believe at 4 or 4:05, where we'll be discussing justice, equity, diversity, and inclusion as it stands in the environmental movement now. So thank you all very much. Take care.